Hey everybody, today we're going to talk again about gynecomastia. So gynecomastia is very near and dear to my heart because it traumatized my adolescence. So it's always been one of my favorite procedures to do. So what is gynecomastia? Gynecomastia is the abnormal accumulation of breast tissue in a man. What causes it? So a lot of guys think that they have too much estrogen, right? Because I'm growing breasts, so I must have extra estrogen. That's actually not the case. Gynecomastia comes from the fact that the receptors in our breast tissue are more sensitive to the circulating estrogen that we all naturally have in our body. All men, we have testosterone, we have estrogen. All women have estrogen, they also have some testosterone. So the receptors in our glandular tissue are a little too sensitive, and that causes them to grow when they're exposed to a normal amount of estrogen. That's why it's one of the most common times for it is during puberty, because in puberty there are a lot of hormonal fluctuations. So there is all of a sudden some more floating estrogen around, and all of a sudden those receptors now cause that glandular tissue to grow. There is usually, now say that usually, there is no endocrine abnormality with gynecomastia. Some of the common causes for it are things such as using testosterone, like you doing cycles in the gym. Excess testosterone will actually get converted to estrogen, and that causes gynecomastia to grow. There are also medications that can cause gynecomastia, such as some blood pressure medications and some acid blocking medications. Marijuana use can cause gynecomastia, and aging can also cause gynecomastia. So gynecomastia can affect any time in life from puberty up through elderly. And the treatments are different. Usually in younger kids, so in the young teenagers, 90% of these will resolve on their own. It goes away without any treatment. Usually I will not operate on children under 16 years of age because there is a very high chance that it will go away on its own. If it persists through maturity, then at that point we address the cause. What do? We treat gynecomastia with surgery. Okay, it is a cosmetic condition. His gynecomastia is severe. He actually has protuberant areolas. Okay, he is about a B cup in bra. He actually has what is commonly called a tuberous breast deformity. So if I saw this deformity in a woman, we would call this a tuberous breast, and there would be a surgical correction for it. He has some extra skin, he has some fat accumulation, and he has puffy nipples. And puffy nipples are a big concern for many men. In this case, I did a ultrasonic liposuction. So I use an ultrasonic wand to break up the hard, dense breast tissue. Breast tissue is actually very hard in men. And regular liposuction many times does not have the oomph, the power to break through it, break it up, and be able to suction it out. So the ultrasound lets me break it up and get it out through the same incision as a liposuction. That incision is done usually in the crease of the breast, where it's very well hidden in what's called the inframammary crease. And then you can see what that turns into. By doing that, I'm able to contour the entire chest area. Now, the addition of J-plasma, which is a skin tightening device, helps not only with causing the skin to shrink down, but it also causes the areola to shrink down. So guess what? No more puffy nipples. The nipples are gone, the puffy nipples are gone. They've shrunk down to a standard diameter, so what would look at as a standard diameter nipple. He doesn't have inverted nipples anymore. Now, in the old days, many surgeons would do a circular incision around the entire areola. That's a horrible scar. It will always be visible, and it will be very self-conscious for many men to take off their shirts. So I'm really not a fan of the old operation, the half moon down here, the full circle. I find that 99% of the time I'm able to get an excellent result using this technique. There's minimal downtime. This is an hour-and-a-half long surgery. You go home the same day. Most of my patients can go back to school and work in about 3 to 4 days, and I let people go back to the gym at 2 weeks. So this is a life-changing operation. I love to do this operation. If you have gynecomastia, it's bothered you, get over it, let's fix it.